Hello, everyone. So as the first lecture, we are going to today talk about autoimmune diseases. So what are autoimmune diseases? Nowadays, we hear everywhere about different names that are all called autoimmune diseases. We see lots of medications on the TV, commercials that are used for different autoimmune diseases. And so what are them exactly? So disease literally means that immune system attacking own cells and own body. For knowing the autoimmune diseases, we have to understand what is the immune system. When we are born, we have different cells, mostly in our blood, that are protecting us against diseases, viruses, bacteria, funguses, and other conditions. Some of them are innate, meaning that they're not differentiated. They are blindly attacking anything that they think it's not us. And some of it's advanced, meaning it can be trained. So you might have noticed that there are some diseases that if you develop once, you might not develop it again. For example, measles. If you had it once, you're not going to get it again, or rubella. And some of these diseases you get vaccination for. Vaccination is using the strategy of our advanced immune system, meaning that advanced immune system has a way to recognize a condition and keep it in its memory that, okay, whenever this pathogen or like a problem, virus, bacteria comes back, I have to attack it faster. So they develop a gun that the next time that the attacker comes, they know the specific gun, they will attack it right away. So you don't develop the disease, or if you develop it much milder. So the vaccination usually uses that part of the immune system. So we have different immune organs. For example, our lymph nodes is a part of our immune organ. The spleen is a part of immune organ. The thymus is a part of immune organ. And the bone marrows, like the inside the bones, which are responsible for producing the white blood cells, are part of our immune system too. So when we have the immune system, initially when we are born, our cells have to be trained that what is us. So the cells are going to know based on the molecules on the surface of the cells. The white blood cells are going to know what is us, what is not us. So they would recognize the molecules on the top of our cells, which are called antigens. And when they see it, they know it's kind of like a flag that if I have it, it means it's me. If I don't have it, it's possibly that it's something else. So, uh, the cells are starting screening like when we are a kid, when we and learning what are our antigens and what is us. So if something new comes to our body, like a virus, like a bacteria, like a fungus, they know, okay, they don't have the same markers on the cells, so they are enemy. We have to attack them, and they will attack it with whatever they have. There is another condition that they have to be aware and attack. For example, all the time, lots of our cells are dividing and increasing. For example, our skin, like lots of time the skin is shedding, and there is new skin always coming up. There are some part of our body that has less cell division, and some parts of our body and tissues that have more cell divisions. So especially on the parts of the body that have more cell divisions, it's possible that sometimes those divisions goes wrong and they produce cells that can have a potential to be cancers. The cells have lots of mutation, abnormal division that can cause an aggressive cell that can cause cancer. When they develop, like when there is an abnormal cell coming, it is very likely that there would be abnormal molecules of the surface. So those antigens or normal molecules that we have on the cells, they would more likely to be abnormal at this time. And again, like our immune system is going to recognize them and attack them. So our immune system not only protects us against viruses, bacteria, and funguses, or like parasites, it also protects us against cancers. And it's always doing this. And if we didn't have a good immune system, we would get even cancers from the childhood. So there are, in lots of ways, if the immune system fails, we develop diseases. So any infections is a type of failure of immune system. Any autoimmune disease is a failure of our immune system, and any cancer is kind of a failure of our immune system too. So when the autoimmune diseases happen, is just that for with different mechanisms, our immune system would recognize a tissue or a cell type as an enemy, and it starts to attack it. Depending on which tissue, system, or cell type that the immune system is going to attack, and depending on what gun and what part of the immune system is used to attack that organ, tissue, or system, the autoimmune disease gets different name. So there are some famous autoimmune diseases that lots of people have heard of. For example, lupus. Lupus is a type of autoimmune disease that affects lots of different parts of the body. For example, it affects the kidneys, it can affect the skin, it can affect the lung, it can affect like lots of different parts, any organs in the abdomen, liver, pancreas, lots of different organs. It can affect the eyes. It can even affect the brain and spinal cord as well. So it can affect lots of different tissues, and there are some markers that if you have positive, you are positive for those markers, and you have evidence of involvement of those organs, they would diagnose you with lupus. Or multiple sclerosis. Sclerosis is another disease that lots of people know as autoimmune disease. Multiple sclerosis is a type of immune system attacking the central nervous system. What is central nervous system? It's the brain and spinal cord. The nerves coming out of the brain and coming out of the spinal cords are not technically the central nervous system. Some part of the nerves coming out of the brain can be still included in the central nervous system, but not the nerves coming out of the spinal cord. So when you have MS, there is an immune system attacking the central nervous system. But it's not only MS that can attack the central nervous system. I just said it in a second ago that lupus can attack central nervous system too. There are other common diseases that can attack immune system, like a central nervous system. The two famous one of them is called NMOSD, or neuromyelitis optica spectrum disorder. Another one, MOG-associated disease, are very common other than MS, and they attack the brain and spinal cord, and they don't usually attack other part of the body. Very rarely, like MOG associated disease can attack some of the peripheral nerves as well, but they're mainly only stay within the central nervous system too. And there are other diseases that affect other part of the body and also attack the central nervous system too, similar to lupus. One of them is called sarcoidosis. Sarcoidosis mostly attacks to the chest, like affects the lung and the lymph node, but also can affect the central nervous system and peripheral nervous system. Sjogren disease, and some of the other diseases like Behçet disease, which is pretty rare, can affect the brain and spinal cord. So there are different diseases with different names. So one way to name them again is that where they attack, and the other important part is that how do they attack. For example, if what are they using? Are they using B cells, which are a type of immune system? Are they using T cells? And what are the other connections? What are other cell types connections? Are they using antibodies? Are they using a complement? These are different names of parts of immune system. How they are attacking, what is the gun they are using, and what are the soldiers? So technically, autoimmune diseases, as I said, is that different diseases that attack our immune system attacks the body, different tissues and different organs. Another like kind of famous autoimmune disease is rheumatoid arthritis. So in rheumatoid arthritis, most of the time we have our joints are affected. Although sometimes the lungs can affect it, the eyes can affect it too, but it usually doesn't affect the central nervous system. So, or like psoriasis, it's more mainly affect the skin and sometimes joint. So this is about the naming of the autoimmune diseases. So what we usually use for treating the autoimmune diseases are in the initial phase, in the kind of the phase that it's acute and the patient is most bothered by it, we use steroids. Sometimes we have to use very high doses of steroids, like IV doses, and sometimes we use oral steroids. Sometimes we can use like a very short courses of a steroid, and sometimes you have to use a prolonged time of the steroids. The steroids technically just shut down the immune system, and by shutting down the immune system, help most of the autoimmune diseases to stop. So that's why they are the first gun and the first thing that we use. But our hope is to try other medications to help not to use the steroids, because the steroids have lots of side effects. And if you take them for a prolonged time, those side effects accumulate. The other medication that we are using instead of steroids can have side effects too, but there is a possibility that you don't develop side effects. The side effects are not as common and as debilitating as the steroid side effects. So we call those medication disease-modifying therapies or steroid-sparing agents or immunomodulatory therapies. So different names. So what those medications do that are not steroids, but they are helping the autoimmune diseases, they always try to modulate the immune system in a way that it doesn't attack us. So because they modulate the immune system and sometimes suppress some part of the autoimmune system, they increase the chance of infection, because our immune system is supposed to help us through the infection. And also they can cause increased chance of cancers. This is a little bit less important and less common, but it's a potential side effect for almost all of immunomodulatory therapies. Some of them are not, but most of them, once you start it, there is a slight chance of increasing cancers. So for your cancer screening, it's better to be up to date. If you are a woman, make sure that you get the mammography. If you're a man, make sure that you are checking your prostate. At any age, you have to check your colon. Some of those medication, you need to have a skin exam to make sure you don't have melanoma. So different, depending on what type of cancers they might provoke, you need to be a little bit more careful about that organ. They might also, because they are modulating the immune system, there's a slight chance that they kind of trigger another autoimmune disease, because they are modulating the immune system, they are weakening a part of immune system, so it's possible that another part of immune system take over and cause another autoimmune disease. So these are like main potential side effects of medications. Other side effects of medications, because lots of medications are cleared through the liver, and there are like kind of things that the liver kind of try to metabolize them, and sometimes clear through the kidney, they might affect kidney and liver. And then depending on what is the medication, the side effects might be different. But the things that usually we have to look for is that make sure there is no infection. If you are taking one of those medication, make sure that you avoid the circumstances that like it increases your chance of infection. Make sure you're up to date with cancer screening, and be aware of the potential other side effects, including other autoimmune diseases. So this is like technically a whole idea about autoimmune diseases, not as specifically for MS or any other diseases. Uh, Stay tuned. I will be back by more explaining about other diseases. Please subscribe and like. So the more subscription and view helps me to spread these videos faster and better. Thank you so much for your helps.